introduction music and visuals, opening shot of a close-up of a healthy eye, slowly fading into a slightly blurred image, a hello and welcome. Today we're diving deep into a condition that can affect your vision dramatically: optic neuritis. Imagine your optic nerve, the critical cable connecting your eye to your brain, suddenly becoming inflamed. That's essentially what optic neuritis is. We'll explore what causes it, how it impacts your vision, and what can be done about it. So, let's unravel the complexities of optic neuritis together. Visuals animation showing various potential causes: autoimmune diseases, infections, medication side effects, etc. So, what triggers this inflammation? Well, the exact cause of optic neuritis is often difficult to pinpoint. In many cases, it's considered idiopathic, meaning the cause is unknown. However, several factors are thought to contribute. Autoimmune diseases like multiple sclerosis, sarcoidosis, and lupus are common culprits, where the body's immune system mistakenly attacks the optic nerve. Infections, such as Lyme disease, measles, mumps, and herpes viruses can also play a role. Rarely, certain medications and toxins have been linked to optic neuritis as well. Understanding these potential causes is crucial for diagnosis and management. A visuals animation showing the optic nerve, myelin sheath damage, and inflammation process. Let's talk about what happens at the cellular level. In optic neuritis, the inflammation damages the myelin sheath, the protective covering around the nerve fibers of the optic nerve. This myelin sheath is crucial for rapid and efficient transmission of visual information from the eye to the brain. When the myelin is damaged, this transmission is slowed or even blocked. This disruption leads to the various visual disturbances associated with optic neuritis. The body's immune response plays a central role in this process, with immune cells infiltrating the optic nerve and causing further damage. A visuals world map highlighting regions with higher prevalence of MS, charts showing age and gender distribution. Optic neuritis is more common than you might think, especially in certain populations. It affects people of all ages, but it's most often diagnosed in adults between the ages of 20 and 40. It is frequently the initial presentation of multiple sclerosis, so the epidemiology of MS has a correlation. The prevalence is also significantly higher in regions with higher rates of multiple sclerosis, particularly in northern latitudes. There is also a higher incidence in women compared to men. Visuals showcasing various visual disturbances, blurred vision, color desaturation, pain with eye movement, etc. Now, let's discuss what you might experience if you have optic neuritis. The symptoms can vary, but typically, people experience a sudden onset of decreased vision in one eye. This can range from mild blurring to significant vision loss. Pain with eye movement is a hallmark symptom, often preceding vision loss. Colors may appear less vivid or washed out, a phenomenon known as color desaturation. Some individuals may also experience visual field defects, such as blind spots. These symptoms can significantly impact daily life and should prompt immediate medical attention. Visuals show eye exam equipment, MRI scans, visual field testing equipment. But diagnosing optic neuritis involves a comprehensive eye examination and neurological evaluation. A thorough eye exam will assess visual acuity, color vision, and pupillary responses. Visual field testing helps identify any blind spots or visual field defects. An MRI of the brain and orbits is crucial to rule out other conditions and to look for evidence of demyelination, suggestive of multiple sclerosis. In some cases, a lumbar puncture or spinal tap may be performed to analyze cerebrospinal fluid. The diagnostic process aims to confirm optic nerve inflammation and identify any underlying cause. Visuals images depicting typical optic neuritis, VES. A typical optic neuritis, an MMO or memojanobody-associated optic neuritis. While optic neuritis generally presents with the symptoms we've discussed, there are variations in how it appears and responds to treatment. We can broadly categorize it as typical and atypical optic neuritis. Typical optic neuritis often presents with pain on eye movement and recovers well with treatment. Atypical optic neuritis, however, might involve more severe vision loss, inflammation of both eyes simultaneously, or a lack of pain. Also, atypical forms can be associated with antibodies like NMOO's neuromyelitis optica or MOG's myelin oligodendrocyte glycoprotein. These forms may require different treatment approaches and follow a different course. Distinguishing between these types is crucial for guiding treatment decisions and predicting long-term outcomes. A visuals depiction of IV steroid infusion, oral steroid medications, disease-modifying therapies for MESTA. The primary goal of treatment is to reduce inflammation and hasten recovery. Intravenous corticosteroids are often the first-line treatment, followed by a course of oral steroids. These medications help to suppress the immune system and reduce inflammation in the optic nerve. However, long-term steroid use can have side effects, so careful monitoring is essential. If optic neuritis is associated with an underlying condition like multiple sclerosis, Disease-modifying therapies and DMT are crucial to prevent future attacks and slow the progression of the disease. Visual rehabilitation may also be beneficial for individuals with persistent vision loss. Visuals, general healthy lifestyle images, balanced diet, exercise, avoiding smoking. While there's no guaranteed way to prevent optic neuritis, certain lifestyle choices can contribute to overall health and potentially reduce the risk. Maintaining a healthy weight, eating a balanced diet, and engaging in regular exercise are all beneficial. Avoiding smoking is crucial as it can worsen autoimmune conditions and negatively impact overall health. If you have a family history of autoimmune diseases, discuss your risk with your doctor. Early detection and management of underlying conditions like multiple sclerosis are also key to preventing recurrent episodes of optic neuritis. A visuals graph showing vision recovery over time, images of researchers working in a lab. The prognosis for optic neuritis is generally good, with many individuals experiencing significant vision recovery within weeks or months. However, some individuals may have residual vision loss or experience recurrent episodes, especially if associated with multiple sclerosis. Recent research is focusing on developing more targeted therapies to reduce inflammation and promote myelin repair. Studies are also investigating the role of various biomarkers in predicting the risk of developing multiple sclerosis after an episode of optic neuritis. With continued research and advancements in treatment, the future looks promising for individuals affected by this condition. An outro music and visuals fading shot of a healthy eye with clear vision. On-screen text, consult your doctor for any health concerns.